Hi guys, I just wanted to update you a little bit on what's been happening and what's going on, and the next videos that I would like to do. In my last video I was ranting about how hard I was finding it and how much work I had. It's similar, it's still full on, but I'm feeling a lot more positive about it, and I'm getting along well with people in my class, and we've gone for meals, and going out for Christmas, and it's just really nice, and I'm getting along with it much better now. The essay I had due was due yesterday, so that's all submitted, that's done, and I can't go back on that. I was saying to a few people as well that I feel that it's not good enough, and I'm just really scared because I don't know what university expects. When I did my BTEC National, I knew how to get A's and how to get all the good grades, and I was able to do that. With university, I don't, and I don't know how to what they're looking for and how to get to that standard. And because it's my first academic essay that's graded, it's just really hard. And just the not knowing what to expect. We get our grades for that in 3 weeks, so I'm going to be really nervous till then. But I'll let you guys know what I get and how I feel about that when it comes. I have an essay due. My next one's due January the 9th. And this should be more interesting because the last one was a reflective account. This one we have to choose an illness and say how it affects the person and the nurse's responsibilities, and it's a 2,000 word essay, so it's quite short but needs lots of research and lots of like reading journals and books and searching the internet and things like that I'll have to be doing. But this one's quite good because I get a meeting with my personal tutor in the beginning of December to discuss. Like I have to draw up a plan, and then I go in with her and discuss what I need to be doing and what I should be doing and how she can help me, and that would be good too because hopefully I'll have my grades for my other essay by then, so I can talk to her about that. And it's just like a 15-minute go in and have a chat with her, but that's good and it's really supportive and I enjoy that. So I'm glad about that. And then I have my exam on the 20th of January which is a 2-hour exam, which is basically everything that we've been learning in our foundation skills. So it's all about all the patient care that we've been learning, the administrative medicine. We've got 10 maths questions, drug calculations, and then it will be all our mandatory, so our CPRs and like paediatric and adult and manual handling and violence and aggression and all the things like that, and all the laws and policies. So there'll be lots of revision to do. And I have another simulation event as well, which is on it's in December sometime, the 3rd or something like that, right at the beginning of December, which is manual handling. So we have to get a patient, I think it's from the chair to the bed or the other way round, and do their temperature, pulse and respiration and their blood pressure and document it. And this time we're just doing it in pairs, which will be really good because that will be more to do. So I'm looking forward to that because that will be the second simulation we've done, and because I've done it before I know what to expect, and I think I'll be more confident and I'll be better at it, and hopefully I'll be able to get more involved, because last time I got the job of documenting and it wasn't really a job that I wanted to do, and it was really hard. And then we had to do our reflective count on that, which is quite difficult because I wasn't practically involved with the nurse that was playing the patient. But yeah, so I'm looking forward to that. We break up for Christmas on the 23rd of December, so day before Christmas Eve, which is quite late, but it's only 4.5 weeks. So 4.5 weeks is lots of work, and then I'm off until all the way until my exam on the 20th of January, which is great. That's almost a month off. Obviously it'll be lots and lots of revision for that exam and lots of work, and I'll have an essay as well due in March, so I'll have to get prepared for that as well. And then at the end of January we'll go on a 2-week placement, and then we pretty much have the whole of February off, where our essay due in March, so that'll be the time doing that. And then we have and then we just on placement basically until our 2nd year. So it's really fun. I'm really looking forward to placement. We find out our placements in December, so when I know, you'll know. What else was I going to say? Oh, what have I been learning? I'll just quickly go through the list. We did a seminar yesterday on death and dying, which was a bit depressing, but At the moment, I really want to work in palliative care. So it was really good. It was really good to discuss what exactly you do when someone dies and how to support them. And we did lots of group work and things. We did a bit of communication as well. We were learning drug calculations. On Friday, we're learning how to administer drugs and all about the charts and documenting and consent and all the legal issues to do with that as well. The week before, we did how to feed a patient, and we had to bring in yogurt, and we had to feed each other like laying down and blindfolded, and we had to play a nurse that just didn't care and was shoving the food in while talking to someone else, and just how we feel and how we would treat our patients. And we'll be doing pharmacology, which is really fun. I haven't got the forms for me somewhere, but I won't find it now. And basically our work for that was to get, we had all these lists of medications, and we had to find out the side effects for them, the dosages, and what they're for, and what kind of medicines they're in. And I'll just show you a book that I've got. It's called BNF. The one I have is BNF for Children. I don't think you have this in America. Well, you don't, because it's a British National Formulary. That's what it stands for. 2011 to 2012. So they bring out a new one every year. And it's a bit like your American drug book that I've seen some of you advertise on your YouTubes. But it's got all the drugs in it, all the dosages, the type of drug they are, the side effects, everything. So really good book, really worth getting. I fortunately got it for free from nurses that I know, get it from pharmacists. But you really want an up-to-date one, you can order these online. You can just type in British National Formulary on into Google, and the website will come up. Another thing, what's very exciting that I have new for you is I have created a Twitter page so that I can update you guys regularly, and just when I'm in uni, be on my iPod and just telling you exactly what I'm doing, just in short sentences. So my Twitter name is Student Nurse, so Student Nurse 92, and I'll put that link below the video down there. One thing that I quickly wanted to ask you guys was if you guys have any revision tips on how to learn anatomy. So I'm thinking of getting big white paper and drawing out things and writing out things, which I'll probably do, but anything you guys have found helpful in just helping you to remember the anatomy and what's going on in the body and all the things like that. And I'll quickly tell you guys, I'm planning to do two new videos, one on drug calculations, which I'll do after this one, and I'm going to do a series on urine analysis and all the things that I learned. I'll probably do about 9 or 10 videos in there, like the bilirubin and the glucose and the pH and things like that, just short, snappy videos. So comment, subscribe, tell me what you think, get back to me on the revision question, and I'll see you guys soon. Take care, bye.